Did you know that over 100,000 people die every year because of adverse reactions to prescribed drugs? That's according to the AMA's own information, the American Medical Association. Now here's something from the FDA's own information. Over 60% of the safety follow-up studies are never even done by the pharmaceutical companies. And here's another thing. Most of the articles that are published in the medical journals nowadays are funded by drug companies. They're the ones who run the studies and print the information. So, gee, I wonder which product will be the recommended one from our study. And don't you just love it, as seen on TV? Ask your doctor. What is it that you're really asking your doctor? You're asking for permission to ingest a substance that has seriously harmful side effects. That's what you're asking. Now sometimes, a drug can be useful, but they're about 85% overused. And then doctors wind up prescribing even more pills to counteract the side effects from the original pills. It's insanity. A health problem does not exist because of the absence of a pill, but that's what they would like you to think. And here's another thing. I'm not sure what the percentage of accuracy is here. I think it's only 51%. Well, only, this is a big number. 51% is over half. But over half of the FDA-approved drugs have been fatal. That means death. Approved by the FDA. The pharmaceutical industry is making a killing, let's face it. So how did we get into this mess? Well, several decades ago, John Rockefeller was interested in making money in oil and pharmaceuticals. And he gave a gentleman by the name of Abraham Flexer a huge grant to destroy everything except allopathic medicine. And he was successful. And ever since then, the medical profession has been dominated by drugs. And some of them are totally bogus. I think it was the Congressional Office of Technological Assistance published an article that something like over 86% or approximately 86% of all drugs on the market do not have adequate proof of efficacy. It means they don't really work. That's a lot. Now, to be fair, drugs can be useful. Sometimes they can be very useful, but they're extremely overused. So natural approaches should be your first line of defense. But we can also be thankful for mainstream medicine because let's say you're dealing with bacterial meningitis. Antibiotics might just be the ticket. Let's say someone has acute appendicitis. Surgery can save your life. If you break a bone, you're going to want to go to a doctor to have it set. So you don't want to throw the baby out with the bathwater. It's just that corporate greed has caused service to be replaced by cutthroat business, which sometimes includes unnecessary surgery, which gives us a whole new meaning for cutthroat business.